Hi, I'm Megan Stumpf. I'm going to be a senior at Normandy High School, and this year I participated in the Science Internship Program for Nursing. My project was on the effects of staff courtesy on patient satisfaction. My mentors this year were Fran Herbst and Teresa Fenor and Daldish Sahota at the Independence Family Health Center. Due to unsatisfactory scores on staff courtesy from Press-Ganey surveys, the Shared Governance of Cleveland Clinic Independence Family Health Center decided to conduct a research project on the issue. Our objectives were to learn why the scores for staff courtesy were not always as high as needed, to develop ways to help improve these scores, to understand what factors had an effect on satisfaction, and to determine if patients were more satisfied if they were escorted during their visit. We formed a group of hypotheses to help us reach these objectives. They were that there are many factors that contribute to overall patient satisfaction, and one of these is staff courtesy both during and after their visit. Ratings of overall staff courtesy will be reflected in their general rating of overall experience. Patients will feel that staff courtesy affected their overall experience during their visits at Cleveland Clinic Independence. We also felt that patients will have higher ratings of their overall experience if they are escorted to checkout areas, and if they were not escorted out, they would score lower. I also felt that patients visiting their primary care doctors in internal medicine will have higher scores than patients who are visiting the specialty areas of pediatrics, urology, OBGYN, and orthopedics. During the summer of 2011, I conducted surveys in the different areas of Cleveland Clinic Family Health Center. 25 patients were surveyed in 8 different areas to total 200 surveys throughout the facility. The survey consisted of 8 statements that the patient rated on a scale of 1 to 5, as well as 2 yes or no questions. There was also a space left open for patient comments. The 4 internal medicine areas were covered, as well as the specialties. My data was collected from the ratings and answers patients gave on these surveys. The overall average scores based on all 8 areas from the survey are: greeted in a courteous, friendly manner at time of check-in with 94%, greeted in a courteous, friendly manner by nursing and medical assisting staff with a 96%, greeted in a courteous, friendly manner at time of checkout with a 94%, rating of overall courteousness and friendliness of all Cleveland Clinic Independent staff 94%, and rating of general overall experience with a 93%. The percentage of patients escorted were 49% for specialty areas and 66% for internal medicine. OBGYN received the lowest scores of all 8 areas, with only 36% of patients being escorted. The overall percentage for the entire Independence Family Health Center was 62%. This graph shows the difference in ratings of internal medicine patients and patients who visited a specialty such as pediatrics, urology, OBGYN, and orthopedics. For specialties, check-in staff received a 92%, medical assisting staff received a 93%, checkout staff received a 93%, overall courteousness received a 92%, overall experience received a 92%, and 59% were escorted out. For internal medicine, check-in staff received 96%, medical assisting staff received 98%, checkout staff received 96%, overall courteousness was 96%, overall experience was 95%, and 66% were escorted out. This graph shows that the majority of patients that were escorted during their visit gave higher scores for all staff courtesy as well as their overall experience. The patients that were escorted out gave 96% for courteous check-in, 97% for courteous medical assisting staff, 95% for courteous checkout, a 96% for overall courteousness, and a 96% for overall experience, while the patients who were not escorted out gave a 91% for check-in, 93% for medical assisting staff, 92% for checkout, 90% for overall courteousness, and 89% for overall experience. The results of this study showed that patients who were escorted through their visits gave higher ratings throughout the entire survey. 98.5%, a large portion of patients surveyed, felt that staff courtesy had an effect on overall experience, and even though it has a positive effect on patient experience, only 63% of patients were walked out at the end of their visit. The ratings for general overall experience were very similar to the patient's ratings of overall courtesy of Cleveland Clinic independent staff. Only one area of medical assisting staff received a 100% for patient satisfaction from all patients surveyed in their area. Patients surveyed in the internal medicine areas rated all aspects of the survey higher than those in the specialties. At the end of my research, I concluded that employee courtesy and friendliness plays a clear key role in the overall experience a patient has during their visit. The overall rating of staff courtesy is very similar to the score given by patients for their overall experience, with a 0% difference for patients that were escorted out and a 1% difference for those that were not. It was proven true that patients have higher ratings for all aspects of the survey if they were escorted from their visit. Patients that were not escorted out at the end of their visit gave overall lower scores than the other patients. Patients do rate higher in internal medicine areas since most are visiting their primary care physicians. My recommendations were all patients should be escorted out by either their doctor or other medical assisting staff to improve their overall satisfaction. Always be courteous and friendly to all patients throughout their entire visit to help improve their experience. Treat the patient in a way that is professional yet friendly. Be available and willing to help the patient through their visit. Staff courtesy has a large effect on overall experience, so something as simple as a smile can improve the entire visit. I would like to say thank you to everyone at the Office of Civic Education Initiatives, my mentors Teresa Fenor, Fran Herbst, and Delder Sahota, my peer mentor Jonathan Harrison, and everyone at the Cleveland Clinic Independence Family Health Center.